today on an all-new Dr. Phil.
Well, Susan wrote to me not once, not twice, but 9 times, desperate for me to help put her 27-year-old son, JJ, back on track. Now, Susan claims her son is a lazy, stealing, unemployed, violent moocher.
It's killing me. It really is killing me, JJ. You're gonna kill me before I have a chance to enjoy any of my grandchildren.
Joining us is Dr. Bradley Jabour. Now, he is the world's leading neuroradiologist with more than 20 years in practice. Now, he did his residency at Stanford University, his radiology fellowship at the University of Southern California and UCLA. He's an expert on the impact of drugs such as heroin on the brain. Now, Dr. Jabour has pioneered cutting-edge breakthroughs in imaging. And yesterday, I asked him to do a very sophisticated fMRI on JJ's brain at his facility, the Medical Imaging Center of Southern California in Santa Monica. Take a look.
I'm really nervous about today. I'm expecting to just find out what's going on in my brain and my whole body. And I just want to find out why I am the way I am. I'm really not sure what to expect.
Good morning, JJ. What we want to do is try and help you. We're going to be performing a functional MRI today.
I'm really nervous.
Don't be nervous. You're going to be inside a tunnel and it's going to make a lot of noise. Try not to move. Just relax. The key thing is to let your brain just wander.
Tell us what an fMRI is. Everybody's heard of MRI. Tell us what an fMRI is.
So with functional magnetic resonance imaging, we now have a mechanism to see the thinking brain, to analyze the brain not just as a shape, but to actually have a window into how the brain is thinking.
Okay, so in other words, we're able to see what the brain looks like when it's performing certain functions, when it's doing certain things. We have an image up now where this is one of the images, a 3D image that you guys generate in this Star Wars technology you have, where you're basically showing the circuitry of the brain, the wiring of the brain. Let's take a look at the first image and see what we have found here. Now, what we're looking here is at JJ's brain scan. We're talking here about basically you see that his brain is actually shrinking inside the cavity, correct?
Yeah, the analogy is if you imagine a grape, a nice plump, healthy grape. It's got a nice smooth, maybe a little fold here or there, but when it becomes a raisin, it shrinks and develops multiple folds. So really, when you abuse your brain over a long period of time, the brain, just like a grape, will shrink back and you'll see more space between the skull and the brain itself. The white represents fluid, the cerebrospinal fluid, that becomes a bigger space when the brain shrinks.
Okay, tell us what we're seeing here. We have JJ's brain on this side, a normal brain on the other side.
So if you think of the brain as a machine, this is a measure of the flow of blood to the brain. A normal brain in a right-handed person should have dominant activity on the left. Now, the red represents good function, more. Blue and black mean less. So between red and blue, you have orange and yellow, so there's this grade of activity. So you have good activity throughout the left brain in this normal person who's right-handed. You can see that in JJ, just immediately, that there's much less red activity. The engine is not working.
Is it too late?
So JJ is 29 years old, right? 27. So we know this, that in a young male, and I think young is in your 20s, if you have a dramatic and determined, prolonged program where you abstain from poisoning your brain, the neuroplasticity, the normal ability of the brain to regenerate, we know that that miracle can happen.